Hi, I'm your host, Amy Freena. For over 30 years, Care Credit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. We are giving you exclusive access to these well-respected and renowned care experts who are all part of our Care Credit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are talking about eyelid surgery with Dr. Edward Park, a board-certified plastic surgeon with both the American Board of Plastic Surgery and the American Society of Plastic Surgery. Dr. Park is passionate about cosmetic, plastic, and reconstructive surgery and has specialized interest in facial aesthetic surgery, breast and body contouring surgery, and minimally invasive procedures. Hey, I'm Amy, and we are live from the studio today with Dr. Park, who is going to give us some insight on eyelid surgery. How are you today?
Very good, Amy. Thank you.
All right, so we're going to just warm up a little bit and get to know you.
Okay.
First question is, if you couldn't be a plastic surgeon, what would you be?
Ooh, can I do two answers?
You may do two answers.
Formula One race car driver or
Okay.
top PGA golfer.
Really?
Yeah.
That's like two extremes. I
Very
like it.
extremes,
All
yeah.
right, very cool. What would you say is the best piece of advice you've ever received?
Wow, that's a tough one. I would have to say to employ into my 4 children, very simple. I say the first rule of life lesson is to try, T-R-Y.
I love it.
Yeah.
All right, great. What about your favorite food?
Okay, this is going to be about how I was raised.
Okay.
I do have a Korean background,
Okay.
and so kimchi is just up there, top on my list.
You need it.
You
You love
either
it.
love it or hate it.
I love it, so that's
Okay,
good.
there you go.
What about someone that you admire and why?
Definitely my parents, who
Okay.
have basically molded me to who I am today, both of them.
Why would you say them?
I like the dichotomy that they raised me with. My father was a very stern disciplinarian, and then my mother counterbalanced with very loving, sweet, caring. So a little bit of both is a good combination.
Very good. What about your favorite thing to do on your day off?
Probably golf with my kids.
How old are your
It's
kids?
relaxing. So I have 4 beautiful children
Okay.
and my lovely wife, and my oldest is 13.
Okay.
9, 7, and my daughter's 5. So 3
Wow.
boys and a girl.
Do all of them go golfing or just the boys?
I do have even my 5-year-old daughter
Really?
swinging the club. She will follow Tiger Woods.
Really? I love
Someday.
that.
Yeah.
Oh, adorable. Okay.
Yeah.
What is one thing other than family in your life that you absolutely could not live without?
I keep referring to golf. It's
He
just
loves it.
golf is an interesting thing because it really teaches you about life. Everything is opposite of what you expect. You want to hit the ball high. You got to hit down on the ball. A lot of interesting life lessons and very serene when you're out on the golf course. So.
All right. Have you binged watched anything lately?
Netflix. The good things on Netflix. I like This Is Us. I'm a sappy guy, and
Me
it's just
too.
a family, great values. My kids love it, so I'm going to go with This Is Us.
All right, solid choice.
Yeah.
All right, so we are going to move into some questions about eyelid surgery. First and foremost, what is it?
So eyelid surgery is a very common request, and I would say a lot of my younger patients that are looking at the face are looking at their eyes. And
Okay.
we always talk about the eyes are the windows to the soul. And we're communicating through our eyes, even
Right.
you and I, Amy. So when we're looking at the eyes, we're basically going to divide it up into both the upper lids and the lower lids. And the first thing commonly where we get requests on, or I get requests on, is the upper lids. And so when we're looking at an eyelid lift, it's simply the excess skin. So when I'm looking at the eyes in terms of what we're addressing, the very first thing is the upper lids. And so with the upper lids, we're simply looking at any of the upper lid skin that's hanging and perhaps even touching the lashes.
Okay.
And so when someone's pointing that out, we're going to do a upper lid blepharoplasty procedure
Okay.
and simple removal of the skin.
Okay. Why do patients opt for this surgery?
I think the most common thing people will tell me is that people say they look tired. And it's a very common thing. I'm sure I've heard it before. Are you tired? And they're commonly referring to their eyes. And so the very first thing that seems to drop is the upper lids, giving them a tired kind of look.
Who would you say is a good candidate for this surgery?
I would say anyone that's in their early 40s is starting to look at that.
Okay.
Again, we want patients to be healthy and have really good expectations. And again, if it's very objectively, there's some lateral hooding and upper lid skin dropping, they're an excellent candidate for that. And it's a very simple surgery.
How much does it typically cost?
I would say, at least in my area, the general range is anywhere from about 3,000 to 6,000, an average of 4 to 5.
Okay. Are there financing options available for someone who maybe doesn't have all the money up front?
I would definitely say that Care Credit is a very, very good option, and it's probably the number one financing option that we have in our office. We have about 30 to 40% of our patients financing through Care Credit,
Wow.
so it's a really nice option for them.
Wonderful. What should a patient expect during the consultation with the surgeon?
The first thing that they're going to do is generally meet me,
Okay.
and that we're going to establish a relationship, and they're going to get to know me. Hopefully, they've done a little bit of research on my training background, board certification, and then essentially I'm asking them what they're concerned about. And if it is about eyelids, then I like to generally hold a mirror up, and I like to listen to what you have to say about your eyes and what we can address.
Okay, awesome. Are there any specific questions that the patient should ask you during the consultation?
Generally, I like them to ask what I like to do, and I
Okay.
really enjoy operating on the face. Commonly, it's asked of me how many procedures I've done.
Okay.
And for eyes, it's generally in the thousands. So we want to
Really?
make sure, that the patient or the surgeon that you're going to is experienced.
Okay. What risks and complications are associated with the eye lift surgery?
I like to say that the eyelid lifts are generally very, very, very safe.
Okay.
Upper lid surgery, we're not going anywhere into the eye, so there's no eye issues whatsoever.
Okay.
So we're talking about simple skin removal whereby there's really very little risk. We do want to make them aware of swelling, some slight bleeding may be a very, very low risk, but other than that, people generally heal very, very well.
Wonderful. About how much time typically off work?
I would give them about a 1 week vacation from work is generally safe.
Okay.
They might be a touch swollen at about 7 days, but generally speaking, they're good to go back to work.
Okay. Is there anything that the patient can do at home to prepare themselves for the surgery?
I don't think they need to do anything special other than for those 5 to 6 days of recovery, they want a quiet environment
Okay.
so that they can really relax. We don't want them to get excited and get high blood pressure. But other than that, just resting.
Okay. Wonderful. All right, so go ahead and tell us how the procedure is performed. Are they under anesthesia?
A lot of the times, and what's nice about facial procedures is we can do it under what's called a twilight sedation.
Okay.
And so a lot of people are afraid, and likewise with myself, that if we can avoid general anesthesia, that would be great.
Okay.
So they're getting a little bit of IV sedation to make them really comfortable. We call it like 5 glasses of wine through your IV.
Okay.
So you're comfortable. I generally spend a very large amount of time, about 5 to 10 minutes, marking the eyelids. We're talking about millimeters, and we want to be very precise in the eyes. We don't
Okay.
want to make any mistakes in terms of the drawing and planning. Once that's done, then the steps are very quick in terms of numbing the eyelids skin up.
Okay.
We're going to remove the skin in the marking positions, usually in an elliptical fashion.
Okay.
Sometimes we'll address a little bit of fat removal in the corner of the eye, and then closing the skin up.
Okay.
Pretty
What
quick.
can the patient expect to experience in recovery?
So in the first 3 days, generally we talk about ice, ice, baby. So we want to,
I love all your mottos. 5 glasses of wine, ice,
Vanilla
ice,
ice.
baby. Okay.
A lot of analogies. But ice is really important for that swelling. So
Right.
for 3 days, we want to be very good about icing the eyes.
Okay. What results can the patient expect as time goes on?
They're going to see pretty quick results, and a lot of my patients at about even 2 to 3 weeks will notice right away that their eyes just look brighter and more open.
Okay.
And I think that's just really, really rewarding for them. Again, we want a very natural result. We don't want anyone to say you had surgery, but like the Kenny Rogers look where the brow's all up. We don't want that. We want it to be very natural. So
Okay.
brighter look.
That's wonderful. All right, Dr. Park, thank you so much for educating us on eyelift surgery. And now we're going to move to the lightning round. I'm going to ask you just some fun questions, and you say this or that. Are you ready?
All right, I'm
Start your
ready.
engines. All right, here we go.
Okay.
Are you a homebody or on the go?
Gosh, both. But when I'm at home, I'm a homebody on the go, on the go.
Okay, makes sense.
A bit of both.
Beach or mountains?
Beach,
Milk, chocolate, or dark?
milk,
Okay. Book or movie?
movie,
Dine in or take out?
dine in,
Okay. Art gallery or sporting event?
art gallery,
Okay. Flip flops or tennis shoes?
tennis shoes, stylish ones.
Oh, okay. I can see. Okay. Sleep in or get up?
I'll get up.
All right. All right. Thank you so much, doctor. We appreciate you.
Thank you, Amy.
Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you're interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store, a thumbs up, and share it with a friend. I'm Amy Freina with CareCredit, and I'll see you soon.